Hello, Nation. Today we're going to talk about the COVID-19 vaccine, and I'm here with my good friend, Jeremy Pettis. So we've had a lot of discussion about the virus itself and who's at risk and things like that, but now the vaccine has come into the picture relatively quickly, and there's lots of questions out there. And remember that the information has been changing quite frequently. We're trying to give you the most up-to-date information. And we're going to try to give you information that's more specific to people with diabetes. So I think, Jeremy, you had a few introductory remarks.
We have to start again with talking about that people with diabetes, both types, type 1 and type 2, are at higher risk of complications, hospitalization, bad outcomes with COVID. And specifically, the newer part of that is the type 1 piece. We kind of knew since COVID first happened that people with diabetes were at higher risk, but we didn't know what category people with type 1 fit in. And I recently was part of a publication with myself and Schaefer Bader here at TCOID and Justin Gregory, who's a type 1 endo at Vanderbilt in Tennessee, where we looked at all the cases that came into Vanderbilt, type 1s, type 2s, and people without diabetes that got COVID, and just asked, how did these people do in terms of being hospitalized, of having bad outcomes, of heart issues, things like that. And people with type 1 diabetes and type 2 diabetes were about a 3 to 4-fold risk of bad outcomes with COVID, and type 1s look very similar to type 2s. So that's important to know that when we talk about diabetes, in this case, we really are all blood brothers. And, so that's the bad news. The good news we're going to talk about is that we have a very effective vaccine now. And because of this higher risk, people with diabetes absolutely need to be getting vaccinated to protect themselves.
Yeah, and that's important. Our very first Facebook Live in March, we were saying that if you had type 1 and you were under good control, your risk wasn't any greater than other individuals with the same age, the same sex, etc. But you know what? We were wrong. Just real quickly, when you say they had 3 times the rate of complications from COVID, and they had a control group, a certain number of people that did not have diabetes.
Right. So it was actually several thousand people that got COVID, but not with diabetes that we compared to the type 1s and type 2s. Now, the other update is that Steve and I have actually both been vaccinated. So at UCSD, they literally alternated. One day was Pfizer, one day was Moderna. So I happened to get Pfizer. Steve happened to get the Moderna vaccine. I've actually gotten the second dose now 3 days ago. So we're going to kind of put in our personal experiences with getting vaccinated as we go through this.
Great taste.
Yeah, less filling, I guess, depending on which one you use. All right, so that leads in this first question. Okay. What are the currently FDA-approved vaccines and how do they work?
Okay, well, I got the first part of that answer, that question. We have the Moderna, which is 2 injections, 28 days apart. And then there's the Pfizer vaccine. The 2 injections are 3 weeks apart. And then after the second injection, you need to wait 10 days to be fully vaccinated and immunized. And we're going to talk about how that will affect your daily life as we go through. But I think the tough question is, how do they work? Jeremy has a background in immunology, so he's going to try to tell it to us.
Yeah, so this is where there's been some confusion and maybe even some concern that these technologies, both of these, work on something called messenger RNA. And that's the part of the cell that actually makes proteins. So everybody watching this is probably familiar with insulin. Every time insulin is made by the body, messenger RNA is made, and that is a message, that's why it's called that, to make insulin or any kind of given protein. So it's something that every cell does. With these injections, what they do is when you get one of the vaccines, these cells actually take this messenger RNA that's injected and start making a protein that is a piece of the COVID vaccine. So, and when that occurs, your body then recognizes this protein as foreign and starts developing antibodies against that protein. So if down the road you actually are exposed to COVID, your body is already amped up, ready to fight it off, and you do really well with it.
That's the spike protein,
right? It's
the
spike protein.
Yeah.
So a couple important things about it. People hear RNA, is that my DNA? It sounds weird, I don't like it. This has nothing to do with your DNA. It's not going to, cause mutations or anything like that. So that's really important. And the other thing is that, once this mRNA is injected into you, it's degraded, it goes away, just the protein is left over. And probably most importantly, this isn't COVID that you're being injected with, which
Yeah.
is some prior vaccines are actually kind of dead viruses or pieces of the virus. You cannot get COVID from getting the vaccine. It's just, it's a way of activating your body against the virus.
Yeah, and it's important to know that this messenger RNA technique, it hasn't been around just 8 months or 9 months. It's been around for years and years. They use that technique to develop all kinds of vaccines. And so it's all, and as you said, Jeremy, you cannot get COVID from the vaccine. And that may have been true with other types of vaccine, live attenuated vaccines. And that's one of the concerns people have who are hesitant to get the vaccine.
So we'll come back to that later. So let's just talk about how effective are they, the vaccines.
Yeah. Oh my gosh. People are amazed that you can see on this graph that it's 95% effective. And I don't think they've ever had a vaccine ever that has been that effective. And one thing that maybe you should point out for the 5%, what time frame?
Yeah, so a couple things. I was wondering, what about the 5%? What if I'm one of these unlucky people that gets vaccinated and still gets COVID? If you get COVID, you have a much more mild course, which is very important, that even if you get infected, you do better. And the people that got the vaccine and got infected with COVID, they tended to get the infection very early after getting the vaccine. So once the vaccine is in your system, you're fully immunized, it becomes very difficult to get the disease. So the bottom line is this stuff works.
Yeah. Well, I should say that once you get the shot, you have to fight the feeling like you're safe. And I always wonder if those people after their first vaccine, they're going, yeah, let's go out and hit the town. So I'm not sure why they got it, but basically you really have to wait until at least 7 to 10 days after your second shot.
Right. So the people with diabetes respond the same. I'll take this one real quick, that almost 10% of people in these studies, Pfizer, Moderna, had diabetes. And they did just as well as people without. So it seems that people with diabetes do well when they get this vaccine. And because of the risk, again, absolutely need to be the first in line to get these shots.
Let's talk about the side effects of the vaccine. Well, your arm could be a little sore the next day. That's probably the most common. But then you could have a flu-like syndrome, kind of like after the flu shot. You can get malaise, you can get a temperature, you can feel the blahs, fatigue. Typically, it occurs in a minority of people, and it goes away in a couple days, and you pretty much take over-the-counter medications. And what happened to Jeremy was, and it's classic, his symptoms were worse after the second injection.
Yeah. So first of all, less than 0.5% of people in these clinical trials reported any serious effects or adverse events
That's this much
from these injections. So it is very uncommon. My first dose, my arm hurt a little bit, just like getting a tetanus or flu shot. The second shot, 21 days later, a little bit of just kind of like apathy, I suppose, but really, honestly, no big deal. So take some Tylenol, take some NSAIDs. Would I do it again? Absolutely. I was thrilled to get, both these injections, and we'll see how you do when you get your second shot here in a week or so.
That sounds like, what's next?
Will the vaccine affect your blood sugars?
Well, the answer is the vaccine itself will not. But let's say you do get a flu-like syndrome, just like anybody that gets the flu, your blood sugars probably will go out of whack a little bit. So just do the normal things you can to keep your blood sugars in range. If you're on insulin, you might need to take a little extra insulin. For people with type 2 diabetes on pills, being high for a little bit isn't going to cause any major problems. So that's the answer, quick and dirty.
And so you kind of mentioned this, but did diabetes meds affect the vaccines? Or interaction you need to be worried about if you're taking metformin or GLP-1s? Any changes you need to make to your regimen?
Nope, not at all.
Yeah. All right, important question. How long will the vaccine protect me, and do I need a second dose? So why don't you take the first part, I'll take the second.
Yes. Now, in these clinical trials, they followed people for 3 months after the second injection, and they were protected. But they didn't want to follow them too long because people in the United States were waiting to get this vaccine approved by the FDA. So you can say for sure 3 months, but when you look at the literature, a lot of people say at least a year. But we just don't know, with 100% certainty.
The same thing's looking to be true for people that were infected with COVID, that we're learning that there definitely seems to be protection, that most people are thinking, somewhere between at least 3 months, maybe a year, and it may be much longer. We just don't know. This disease has only been around, since 19. So, do you need a second dose? And the short answer is yes. there was this kind of discussion when there was initially a slow rollout of the vaccine of, well, would it be better just to vaccinate everybody at least once and kind of forget about the second dose? The kind of quick and dirty thinking about the first dose is it's about 50% effective, whereas when you get the second dose, it's 95%. So absolutely, when you do get that first appointment, make sure that you're in town 21 or 28 days later to get that second dose, because otherwise it's almost a waste of time.
Yeah, and most systems have it built-in reminder system. So if you're ever going to be super vigilant about showing up on time, this is one thing for sure.
Now, next question is that there's been a lot of talk lately about these new variants of COVID, starting kind of overseas and now being here, that the virus has mutated, that it's more infectious now. So I think some concerns about that are that, is the vaccine going to work against it? Like, talk to me about that.
Well, there's been a lot of talk about that variant, and the state of what we know now is that the variant is more infectious, but not more dangerous, doesn't cause adverse outcomes anymore, and it is susceptible to the effects of the vaccine. So right now, I think it's important to, do the social distancing, more important than ever. Let me just say that these mutations are super common. That's why you get a different flu shot every year, because the influenza virus mutates quite a bit. And I want to point out that the flu shot every year is about 50% effective compared to the vaccine for COVID, which is 95. So it's impressive, really impressive.
All right, so, what's the rollout? Who's getting it first? And then I'm going to talk a little bit about the prioritization of type 1s and type 2s, but talk a little bit about the tiers and all that.
Yeah, I'm not going to go into it in too much detail because it's different from state to state, region to region, city to city. Our rules in San Diego are different than LA. To make it really short and simple is that, they're going to get the people working in the front line, healthcare professionals. That's why we got ours. We do inpatient work. And then they're just starting to go down. All healthcare workers, any individual that is around the public. And then they got to the nursing homes. First they did the assisted care, then independent. And now in San Diego, we're going to be getting anybody over 65.
Yeah, so really you're kind of dependent on your local situation, and specifically for getting the vaccine, making sure you have a primary care doctor. UCSD has a web page now with all the frequently asked questions about how they're going to roll this out, and that's different wherever you are.
Yeah.
So make sure you're in touch with your provider, because that's who's ultimately going to be the one, putting the needle in your arm.
The other thing that Jeremy's going to talk about is that, us folks with type 1, type 2 diabetes, we are more at risk. We have underlying conditions, and we are now in that category to get the vaccine, ages 16 to 65 with underlying conditions.
And so an important part of that is, as we hear about we're in this tier now, the other part of that is the vaccine available? So just because all of a sudden we're in a tier doesn't mean that everyone can rush to their doctor and get it. You still have to have it, available, which is causing some confusion. So real quick on this type 1, type 2 issue, currently the CDC lists type 2s at an increased risk, and type 1s may be at an increased risk. But because of the results of this publication I mentioned earlier, we've actually sent a letter to the CDC yesterday, signed on the behalf of the ADA and JDRF and a number of other diabetes societies, urging them to change that to say type 1s and type 2s are an increased risk, period. Put us all together, which is appropriate based on what we know now.
When you sign up for the vaccine, a lot of places, they don't differentiate. You have diabetes. Yeah. And listen, we should take advantage of the fact that we have a condition that we don't want in the first place to help us get the vaccine sooner.
So if I've already had COVID, should I get the vaccine?
Yes. You should wait 90 days after your symptoms go away. Pure and simple.
Yep. All right. Can you get COVID-19 from the vaccine?
No, we've already addressed that issue.
Zero chance. Now, if I get the vaccine, will I be able to infect others with COVID? Let's say I got the vaccine 2 months ago. Am I still contagious?
Yeah, that's a really good question. I mean, intuition says no. If you can't get it, you can't be a carrier, you can't give it to other people. But it's not that plain and simple. We just don't know. It's possible that you could be a carrier. Let's say I had florid COVID, I give you a big hug, and you walk you go somewhere to work and you're in a close proximity to other people. We just don't know. So the answer is it's possible. And that's why we have to still do social distancing, wear a mask, wash our hands, even if you got vaccinated. It's the safest way to go.
Right. We still have to be good citizens and take care of ourselves because we just don't know. Should you still get a regular flu shot?
Absolutely. They're two different things.
Yeah.
So getting the flu shot is important. There's no overlap. There's no worsening of symptoms. And I've heard a lot of people say that, well, it's a good time to mention this, that a lot of people get kind of severe reactions to the flu shot. That's just their immunology system, their immune system. And those people may get more symptoms when they get any type of vaccine, including the COVID. So tell your doctor, just be cautious. Have that observation period maybe a little bit longer. Be prepared to take the day off or something like that.
I would say it's actually more important than ever to get the flu shot because, let's say you haven't gotten COVID yet or the vaccine and you don't want to get both these viruses at the same time. I will say it's been a very mild flu season because people have been doing social distancing and wearing masks things like that. That just infections in general are down, which is a good thing. All right, so this is getting, to kind of a $1 million question now. Why are people not taking the vaccine? When you hear about these reports online of people, percent of people refusing it, even healthcare workers.
Yeah.
So let's go through these one by one.
We're not going to be able to cover all the reasons because there's lots of reasons.
Yeah.
Religious, political. We're going to skip those because we don't want to get in a fight with anybody.
But okay, so one, they're afraid they might get COVID. We've already talked about that you cannot get COVID from the vaccine. So I think we can hopefully take that one off the table because it's not the virus. It's completely different than getting the virus injected into you. So they're afraid of the side effects?
Yeah, well, we have data from the clinical trials that less than 1%, but also, as you just mentioned a few minutes ago before we started the filming, there's been over 10 million Americans. And after you get a flu shot, depending on the system you're in, you're going to get a text every day for a week.
No, not a flu shot, the COVID shot.
Sorry, the COVID shot. Thank you. You're going to get. They follow people's symptoms. Have you had a fever? Have you had pain in the arm? How do you feel? And so they're collecting data on tons of people. So it looks like the side effects are extremely low.
So, and I think that's the thing you hear the most commonly is that people say, I just want to wait for more data. I don't know about this new vaccine. It all seems like it happens so quickly. And there's a lot to kind of unravel there. So first of all, 10 million people have already gotten this vaccine. So that's a lot of people that we have data on. We've done all the clinical trials. They happened very quickly. However, they still happen the normal phase 1, phase 2, phase 3. They all still occurred in kind of the regular process, still reviewed by the FDA. This messenger RNA stuff isn't a completely novel approach. So there's a lot to it that makes me feel comfortable about it. That this data is now out there. That I think that this is a safe way to go about it.
Yeah, and I think it's important to talk about this herd immunity. It turns out that herd immunity makes a lot of sense. That they need I've heard 70 to 80% of the people in the United States or any country to get the vaccine. And what happens then is it stops being spread and it goes away. And that's how these bubonic plague, polio, other serious conditions become part of our history books. And that's why, if you don't want the vaccine, hopefully you get to the point where you feel comfortable. But it is helpful for not only yourself, your family members, but society in general.
I want to say one specific thing that comes up a lot when people say they want to wait. That you'll hear these reports that something like 40% of healthcare providers are refusing the vaccine. And that can make you think, well, I'm not going to get it. Look at the people in the know, they're not getting, why would I do it? Keep in mind when they ask healthcare, professionals or workers, that's everybody in the hospital system, doctors, nurses, yes, but also people in the food services and maintenance and everything. So it's not like it's just, they're asking, the infectious disease experts. This is a population that's actually more representative of the country at large. And when they ask physicians, it's more closer to like 90% of people that are actually, wanting to get this. So keep that in mind also.
Yeah, and I do think that number is going to go down.
Yeah.
And as more and more people get it, and we learn more and more data on its safety, I do think that will change. And you know what? I think you and I respect anybody that's hesitant. So you can feel free to email us on the TCRD website some of your fears, concerns, and we'll be happy to answer.
So I think, some concluding remarks is that, honestly, it's been remarkable that we're almost exactly a year out from, at least in the U.S., of when we were affected with this. And now the whole arc of finally getting vaccinated, myself being double vaccinated, you're almost there, and rolling this out to, people with diabetes and people listening is pretty remarkable, and it's good news. We kind of spent this whole thing being on the defensive, honestly, like, don't worry about this, don't worry about this. I'm thrilled that we're here and that we're starting to get people vaccinated.
We're on the offensive now. It's really the light at the end of the tunnel. Think about it, that if an individual gets vaccinated, he or she is safe from getting COVID, pretty much. And as far as we know, they're pretty much at a point where they cannot pass it on to other people. We talked about being a possibility, but if they're not going to get it, then that's going to be helpful. So the spread's going to start going down and down and down. And as more and more people get the vaccine, the availability, different distribution sites, I predict that COVID is going to be a thing of the past. And that as soon as 80% of our society can get the vaccine. So there are issues there, but I think it's really exciting news. This is the first super positive thing we can talk about since COVID hit, at the beginning of last year.
Yeah. So like Steve said, let us know your questions, comments, concerns. I'm sure there'll be a lot of interest in this topic. And that's all I got.
So long, nation.
Yeah, so long.